Okay. Good morning, everyone, and thanks for joining us. So I'll start with a quick update of our numbers over the weekend. So since the 17th of September, we have 118 new cases in Windsor-Essex. 49 of those reported for the September 18th, 42 on September 19th, and 27 reported on September 20th, so the period from the 19th to now. Overall, 48 of those cases are close contacts of a confirmed case, 28 are from the community, 11 are outbreak related, and 3 are travel related, and 28 cases are still under investigation. Currently, we have 448 deaths overall in Windsor-Essex related to COVID-19, and we have 15 individuals currently in hospital. 4 individuals are in the ICU. And in Windsor-Essex, we have 22 active outbreaks currently, 15 workplaces, 5 school outbreaks, 1 long-term care home in outbreak, and 1 outbreak in the community. As well, we continue to have school dismissals as a result of COVID-19 exposure. Between Friday and today, we had 15 dismissals within our schools. And overall, we've had about 65 total dismissals approximately since the beginning of school. I'll now turn it over to Dr. Shankar Necessary. Thank you.
Yeah, so, good morning, me and my colleagues in the media. We continue to recognize that COVID-19 has a significant burden to the community. We continue to try to work on strategies for containment, especially at schools. The one thing I would share is it's just not the people exposed. It's just not the people who have COVID that provide an indication of the burden, but also the people who have to self-isolate. And for every person who is infected, there are many, many more people who have to self-isolate. And we continue, and I know this message seems repetitive, but it is the most important thing, which is that we all can do something to mitigate the consequences of COVID-19. And that includes, if you're home, if you're sick, stay at home, wear a mask indoors, wear a mask when you can't be 2 meters away from another person. If you're eligible for vaccination, please get vaccinated. Try to minimize your human-to-human interactions. All of those things could help mitigate COVID-19. As a matter of public health strategy, our health district is working diligently with the school boards to try to continue to keep schools open for instruction. So with that, thank you, and we're happy to answer any questions at this time.
So we'll now take questions from the media. We'll start with AM 800.
Nicole, do you have any? Do you have the number of active cases in our community right now?
Nicole, I think you're muted.
Yep, just give me one moment and I can tell you the number of active cases. There are 366 active cases at the moment. 224 are associated with a VOC.
Okay, thank you. Doctor, just in regards to the school cases, like Nicole mentioned, 65 classes have been dismissed so far since the beginning of the school year. I know Nicole talked about this last week, how that number, the health unit obviously was expecting dismissals, but I guess the rate, just how concerning is this, and do you feel it's going to continue to climb as the school year and I guess the rest of the month goes?
Well, it's difficult for us to, medicine is difficult to predict the future, and I'm not sure I can offer any specific prediction on this item. We do remain concerned of exposures at schools, because when, if there is an exposure at school, so I'll give a hypothetical example, but it's probably consistent with the evidence. A young person gets on the school bus this morning, is sick, and has respiratory symptoms, and then that young person comes to school and goes to a class, and then sometime later that young person is recognized to have COVID-19. the young people on the school bus and the young people in that classroom are all excluded from school for some period of time. And so one inadvertent exposure or one can lead to 10, 20, 30, 40 young people being excluded from school. And that's particularly why we think it's important for parents to, regardless of vaccination status, if a young person is sick, to remain at home and not send them to the school. So we are concerned and we remain concerned. I think every person, it's not only the public health district that's concerned about schools, but I think it's school teachers, school principals, school board officials, and most importantly, parents in the broader community.
With the vaccine certification program going into effect this Wednesday, are we seeing more individuals heading out to get the vaccine, Nicole?
We have seen a steady, I wouldn't say we've seen a spike. We have seen a steady number of individuals, coming to the assessment centers for their first dose, which is encouraging. So, we are seeing a number of people who are coming for their first dose, a pretty good percentage. I wouldn't say it's the flood that we hoped for. We still have, approximately 70,000 individuals in our community unvaccinated. So a lot of work to do, but at least we are seeing a steady number of first doses within our assessment centers, which is encouraging.
Thank you.
Yeah, and if I could supplement that, the health unit appeals to all the people who aren't currently vaccinated who are eligible for vaccine to go get vaccinated. If you are vaccinated, you're helping yourself. If you're not vaccinated, you're helping yourself by getting vaccinated. Vaccinated people are less likely to get COVID. If they get COVID, they're less likely to be very seriously ill. They're less likely to be hospitalized. They're less likely to die. And so getting vaccinated is likely to help you. Also, getting vaccinated is likely to help your children and your parents and other members of the community. And it's also likely to help your coworkers. If you end up going to work and you have COVID, that means that your coworkers are likely to be dismissed from work and excluded from work. So one of our core messages is that those people who are not currently vaccinated, please get vaccinated. If you know someone, and everyone knows somebody who's probably not vaccinated, if you know someone who's not vaccinated, have the dialogue with them. Ask them if they would consider doing it, not if they can't do it for themselves, to do it for their family and their community, because it's probably one of the most important things we can do to try to bring COVID under control at a community-wide level. I also want to share this. I think it's reasonable to articulate that Windsor-Essex has suffered disproportionately from COVID compared to other health districts. My belief, and Nicole can correct me, that Windsor-Essex had a more extended period of shutdown under the previous COVID management strategy. So it's particularly important for the community of Windsor-Essex to come together to try to make an effort to bring COVID under control or reduce the burden of COVID-19 on this health district. Sorry for being long-winded on this.
Thanks, Doctor.
Any questions from Blackburn?
Yes, I came in a little bit late. Nicole, could I get you to tell me again how many cases total we had over the weekend and what the breakdown was day by day?
Yeah, just give me one moment. So we had a total of 118 over the weekend, and 49 were reported for September 18th, 42 September 19th, and 27 reported on September 20th. Of those 118, 48 are close contacts of a confirmed case. 48 are close contacts, 28 are from the community, 11 are outbreak related, 3 were travel related, and then 28 are still under investigation.
Okay. I wanted to ask you what the turnout was like at St. Joseph's assessment clinic on Friday, and how many cases were uncovered there, if you know.
So we're still collecting data as it relates to that. So as you know, with the number of testing happening, it does, the turnaround time, is just a little bit. So we do have some pending results for the actual testing at the school. It was more than 300.
Are you happy with that result? Because there's 800 kids there.
Yeah, well, we know since there were already quite a number of students that were dismissed and had already been directed to test, as well with the announcement on the Wednesday and the school clinic on the Thursday. We suspect that many had gone to the either assessment centers on the Thursday as well. So we are pretty happy with the number of tests, although we don't have the exact total number of individuals who were tested, and there are still some pending results. So we'll be reviewing all of that today.
Okay. And is there any indication yet when St. Joe's may be able to reopen?
So we'll be talking with the school boards this morning, again, with the bit of information that we do have and discussing plans for students' return. So we'll have more to share certainly after we have that conversation with the school boards.
Thank you very much.
Any questions from the Windsor Star?
Hi, yes, thank you. I guess I just had another question about schools. So with the number of classes that have been dismissed to date, is that consistent with what the health unit would have expected going into this year, or is it higher or lower than we might have expected given how COVID has progressed over the last several weeks?
Yeah, so, obviously, it's hard to make predictions and projections. This is true in medicine overall. Doctors, for the most part, are unwilling to speculate about the future because we can only work with the facts and circumstances that we have today. Secondly, COVID-19 is a new disease. It's a new public health challenge. And so it doesn't give us a lot of historical data to make projections moving forward. That being said, the lower the number of dismissals, the better. And if, and quite honestly, if we had 0 dismissals at the current time, that would be our optimal situation. The number of dismissals is likely in some way to be related to the background risk in the community, meaning that if there are more people in the community who have COVID, it's more likely that COVID will make its way into the schools. And if it makes its way into the schools, there's probably a greater likelihood of young people being excluded from schools. And so we have to try to take that management plan, that public health management plan, as one entire approach. I remain hopeful that we'll be able to work on containment, and containment is one of the current public health strategies, which is to make sure that the background risk, the number of people who have COVID or potentially transmit COVID in the community is low. If COVID makes its way into an institution like a school or a workplace, that is contained to as few people as possible. And if it does make its way into a workplace or other institution like a school, that it doesn't spread throughout the entire institution. So that's the strategy that we are currently working for. And we'll keep you updated on where things might go in schools as the events progress.
Great, thank you.
Any questions from CBC? Sorry, Peter, I saw you just joined us. I thought you might have a question, but if not, I'll keep going through and we'll work you back into the loop here. Any questions from AM 800?
I'm good. Thank you very much.
Okay. Any additional questions from Blackburn?
Nope, I'm good. Thank you.
Okay. Any additional questions from Windsor Star?
No, I'm good, thank you.
Okay. And then we're right back to you, Peter. Any questions on your end?
I'm sorry, I missed almost all the other questions, so I'm not sure if this would be repetitious or not, but I know that with so many of these school cohorts being dismissed over the past couple of weeks, there will come a time when these students will be returning. Is some of that already happening, or how long does that whole process take?
So yeah, so when cohorts are dismissed, they're dismissed for a period of 10 days from the date of the exposure. So to the person who is positive for COVID-19. So it depends on the timing that they're dismissed, but the total, they're asked to isolate for 10 days from that exposure. So it can, it could be 10 days if we caught it right away, or, it might be, 5 days. It's all dependent on the time that they're dismissed and their exposure.
Is there any sense at this point whether the pace of new cases being seen in schools and dismissals happening, is that still more so than people who are starting to return, or is there any kind of way of measuring that balance?
Well, I think that, first of all, no one data element tells us the burden of disease in the community, and you have to sort of place it all within context. I think it is concerning that there are 65, and Nicole can correct me, there are 65 cohorts of dismissals, and there are dismissals both in primary and secondary school, as well as at exposures at the community college. I think that the one thing to think about is the amount of time that one is dismissed or excluded is based on the time from exposure. For an individual, that's typically 10 days from their exposure or their calculated exposure or perceived exposure. So we try to make decisions based on the best data that we have to try to effectuate containment.
Okay, thank you very much.
You're welcome.
Thanks, everyone. That's it for today. I hope you all have a great day and everyone goes and votes. So have a great day. Bye, everyone.
Bye-bye.
Sorry. All the best.